This comes as the key COVID-19 metrics in the state of Maryland are slowing down. More than 7,800 new cases were reported in the last day. That's almost 900,000 confirmed cases. 159 fewer people are in the hospital. The positivity rate is now decreased under 22%. Governor Larry Hogan criticized the federal government's response to a surge in COVID-19 cases that has strained the state's hospitals. Governor Hogan also criticized the federal government's handling of masks and emphasized that Maryland is set to distribute KN95 and N95 free of charge. Now the confirmed cases are topping off with more than 900,000. With the 24-hour period, there are 6,500. 60 fewer people are hospitalized. The hospitalizations continue to drop downward, and so did the positivity rate. One of those researchers does say that rapid tests save time and money. Over 1,000 patients, 17 and younger, participated in a study by Johns Hopkins researchers. Each patient took a PCR test and a rapid test. The results show rapid testing was highly in sensitivity at detecting COVID-19 in those children, including those who were infected but not showing symptoms. Researchers say among those positive cases found using a PCR test, 90% of those were also detected by the rapid test. Researchers believe this study could play a role in allowing students to limit their absence from school while in quarantine or waiting for their PCR test results to come back. Researchers say that a negative rapid test should not take over those other COVID-19 precautions in children, including masking and social distancing. More than 3,200 new COVID cases have been reported overnight in the last 24 hours. 2 fewer people are in the hospital, 68 people have died, and finally, the positivity rate dropped down by 19.77%. Of course, the positivity rate and the hospitalizations are moving in the right direction. Baltimore City is offering an extra hand when it comes to the supply of at-home rapid test kits, along with the masks for Baltimore City Public Schools. Mayor Brandon Scott visited schools throughout the city, distributing with a total of 50,000 at-home COVID test kits and 40,000 face masks. More than 4,000 new confirmed cases of the coronavirus being reported, again with the positivity rate and hospitalizations have decreased. Doctors say there are not quite, but there is a light at the end of the tunnel. The surge has been stretching on a little bit longer than where it started in South Africa, the Omicron variant. That's due in part because of a different demographic and also vaccination status. Dr. S.D. Shawman with Sinai Hospital say for the last month, Omicron has taken center stage. Seam-splitting infections and hospitalizations numbers are starting to tick down slightly after a surge broke at an all-time high record. This is a significant decline from nearly 30% positive rate 2 weeks ago, but the chief medical officers say we still need to have pavement to bind ahead. As the virus lingers, Dr. Shawman says the most important thing you can do to decrease the risk of the next variant develop is get vaccinated, wear a mask, and social distance. And doctors say there is 2 major differences between this surge and past 2 reasons. 1, less force. There is a lot less healthcare workers. And number 2, fewer testing resources, which is why crucial for you to take advantage of any drive-through walk-ups, testing sites that either the city or a county are offering, plus at the White House is able to send you a free 4 at-home testing kits. They are showing a decrease of 18% of the positivity percentage, nearly 9,000 confirmed cases being reported, and fewer than 68 people are in the hospital. In Maryland, First Lady Yumi Hogan, one of those latest confirmed cases. A month after Governor Larry Hogan announced he had COVID, and Yumi Hogan as well had tested positive. He says Yumi is doing well in isolation at home. Governor Larry, speaking through a mask Thursday, said had a pair of negative COVID tests after the First Lady tested positive. The governor announced a new hospital-based testing sites open in Carroll County with GBMC, that stands for Greater Baltimore Medical Center, and St. Agnes, opening Friday and Saturday respectively. Hospitals and the percentage positive rate continues to show a strain even as hospitalizations falling down below 3,000 on Thursday. The hospitalizations are showing a three-figure numbers decrease, and it's moving in the very big right direction. Now, the cases of the coronavirus are 4,700 reported. The positivity rate continues to decrease. This comes as Governor Larry Hogan says 94% of adults in our state have received at least one dose of the vaccine. 4 million Marylanders have been fully vaccinated, and he continues to reiterate that getting vaccinated is the best way to protect yourself from severe illness. The state runs COVID testing sites that open in the morning at Greater Baltimore Medical Center in Towson, Maryland. It is open every day from 9 to 3, and you don't need to make an appointment. The testing sites at St. Agnes is going to open up as well tomorrow. If you want to go to GBMC in Towson, Maryland, you have to use I-695 to get to exit 25 on Route 139. Address is 6701 North Charles Street in Towson, Maryland. Or if you live in Towson area, you can go as well. Showing with the COVID-19 that there are more than 4,800 new cases were being reported in the 24-hour period as of yesterday. We have 931,000 confirmed cases. Hospitalizations and the positivity rate are continuing to going in a big all-time low with the right direction. Baltimore County announced new dates to give out more tests this week. There are already thousands of rapid tests giving out to people in the area. There will be almost 30 locations giving out tests this week, both drive-thrus and walk-ups. If you want to keep on looking at that COVID-19 data chart and COVID-19 vaccination data chart, just in case, ladies and gentlemen, if you're new at this or you may have seen it before, you can look at it over and over to keep track of the data charts. And if you live in the state of Maryland, whether if you're in Hartford, Cecil, Baltimore, Kent, Howard, Anne Arundel, Montgomery, Frederick, or anywhere in counties in Maryland and including the Maryland city areas, it does not even matter. To look at the COVID-19 data charts, just log on to their Maryland's link at coronavirus.maryland.gov to click it. It's on the description below.